There's something about the strength of a woman. Don't you agree? Somehow, some way, she persists, overcoming obstacles and finding new paths to success, doing good in the world. Hi, this is Candy O'Terry. Welcome to the story behind her success. One of the scariest things we ever encounter in this life is a cancer diagnosis. And over the last few weeks, we've been saluting breast cancer survivors. This week's guest heard those words twice, but her story focuses on what she did for other women with the creation of My Girls Skincare. Inspired by a visit to Eastern Europe, where she noticed that women's skin was flawless, this all-natural skincare brand is dedicated to providing chemical-free comfort for cancer patients. During radiation treatments, when our skin becomes irritated, during chemo, and when we're taking drugs like tamoxifen, which cause muscle cramps. Cancer centers across the country are catching on, and they're suggesting that their patients use My Girls skincare products. Today's guest has created a product your skin will thank you for. Her name is Teresa Karastesh, and this is her story. Teresa, welcome to the show.
Thank you, Candy.
It's such a pleasure to meet you, and thank you for bringing your daughter. She's lovely.
Thank you.
You were first diagnosed with breast cancer back in 2007. How was your breast cancer discovered? Can you share that story with us? And what was the initial diagnosis?
Sure. I was laying on the family room floor and I was playing with Ava and I found a little lima bean sized lump. And so I thought, oh gosh, my mom had breast cancer. So I thought, could this be something? So I went to Newton Wellesley Hospital and I had them take a look at it. And they said to me, come back in 6 months. It kind of looks borderline, but come back in 6 months. And so I was busy working as a consultant, flying all over the place, and I didn't go back. And I thought they didn't take it extremely seriously.
How old were you when this happened?
I was 40.
So you had just started getting mammograms, right?
No, I actually started at 35.
Because of your mom.
Yes, and I had a wonderful doctor at Newton Wellesley back in those days who she told me, you need to start early. And she also told me you need to get out and exercise at least 150 minutes a week to make sure you stay on the right path.
You know, so many women avoid mammograms. So what's your message to the woman who's afraid to get a mammogram?
I would say take an Advil and
get over it.
And show up. Yeah, just get it done.
Take us back to that moment when you went back and got your results and heard the words, you have breast cancer.
I was devastated. At this point, it was 2007, and I just had my second child, and he was just about to turn 1. We had a trip planned to Hungary because my husband had gone to medical school over there, and he had lots of friends and family that we had never met. So they told me at this point, yes, it's breast cancer, it's DCIS, and you'll need radiation. But go on your vacation and come back and we'll treat you. So I went over to Hungary just with this horrible feeling in the back of my head, but still trying to have a good trip with the family. I ended up meeting a woman at a party who I was talking to her about the skincare because my mother-in-law, Eastern European, had just gorgeous skin. I said, what is going on here? And she says, oh, the Hungarians and Eastern Europeans take it very seriously. And so if you happen to be out in the country, go to every little apothecary that you can find. And so that's just what I did. And the only thing that I could read was rose hips and rose petals. And I didn't know the benefits of calendula at that point, but calendula is also an excellent anti-inflammatory. So I picked up a lot of different products and I brought them home, and then I went through radiation and I started to burn like crazy. And whatever they told me to use, at this point I was at Mass General getting treated. And so my husband said, try that Hungarian stuff. And I said, why not, right? So I put it on, and my team at MGH, they were amazed. They were like, you're tanning. What are you using? Would you please bring it in? So I brought in the cream, and they said, this is calendula. We love it. And you're doing just fine. And within 3 to 5 days, I was on the way to getting blisters and terrible burns and itchy, very itchy. So I started with that. Within 3 to 5 days, it turned into a tan.
Wow. So you've got a bachelor's degree in economics from Fordham, an MBA from Babson College, plus 20 years of corporate experience. You referred to that when you were talking about flying all around the world when you got this diagnosis. So you brought a lot of knowledge to the art of starting a business. So you're inspired by these products. Take us back to the early days of My Girl's Skin Cream.
Well, when I reviewed the product with my team at MGH, at that point, this product was pink. It had retinol in it. It had fragrance, and it had dye. And so they said, none of those things are going to work. You need to refine it. So I went back to the manufacturer in Hungary, and I said, can you do this? The kids were in elementary school at that point. My son was in daycare. And I sat all day long researching ingredients and trying to figure out what was needed and what was not. And the manufacturer followed my directions, and it came out to be more of a whippy type whipped cream formula, which spread over blisters and burns very easily.
Yeah. So tell us about your product line, and we have it right here. So what is your best seller?
So the original formula, this is the My Girl Skincare, and we've basically looked at that formula and did a product line extension based on the calendula and anti-inflammatory ingredients that could help people during treatment and after treatment ends. So everything is ultra soothing for sensitive skin. So in fact, I met with a customer last night at a big hospital in Boston, and she said, I had a woman come in here and she said, my skin is so itchy and I'm so sensitive. There's nothing I can use. Even with the products that they give me, it doesn't work. She says, do you have that My Girl's cream? I used it during radiation. Can I just have a jar? And so now she comes in regularly. And I hear that over the phone, and it just makes me so happy that there's something that is truly unique and very effective.
You know, if you are listening to this interview and you're just going through radiation treatment right now, My Girl's Skin Cream is going to help you so much. And I can tell you that when I would go into the room to get my radiation, I would bring my cream with me. And then when I'd get into the dressing room, I would slather it on immediately right after radiation. Is that what you did too?
You know, I didn't follow rules because entrepreneurs don't follow rules. And that's why I started to blister. So what I did is when I got back home, I would put it on,
Okay, so you guys listen to Candy. Don't listen to Teresa.
Exactly. Now, but, I got diagnosed again in 2019 with lobular. So the first side was left side DCIS. In 2019 was lobular on the right side. And you bet I brought it into the treatment room in my pocketbook. That was what I had.
I want to talk a little bit about the experience of having breast cancer and hoping, praying that it's never going to come back. And now you are revealing a second diagnosis in 2019. Mm-hmm. Can you take us back to that moment? How did you respond to that?
I was devastated, I have to say. I thought by running, I ran marathons, half marathons. I watched what I ate. I was on tamoxifen for 5 years. Looking back, it would have been probably better if I was on it for 10 years. But I said to myself, okay, obviously this is your mission in life, and you have to just keep moving forward.
Adversity is a great teacher, and sometimes the lessons that we learn during those hardest times in our lives are the lessons that matter the most. What have they been for you?
I would say don't be so hard on yourself. I've always been quite a workaholic. It was crazy, having 2 kids under the age of 4, running marathons and starting a business. Somebody should have sat me down and said, be kinder to yourself.
We're sitting here and there's a whole table full of your beautiful products. And so we have My Girl Enlighten and Brighten Serum. We have aluminum-free deodorant, which is very important during radiation treatments because you're not supposed to wear deodorant at all unless it's aluminum-free. We also have a beautiful peppermint and tea tree hair and body wash. Cool Comfort Gel. Cool It. What is this for?
That's for muscle pain. So when you go on chemo, and all the different medications that they give you, you can have severe muscle discomfort.
And cramps.
Mm-hmm.
Yes. Calendula After Sun Cream.
That's just a nice cream, because you're extra sensitive to the sun after radiation.
My Girls, what is this?
This is Marigold, and it's a barrier cream. So when you're going through chemo, your skin gets ultra sensitive. Like every morning I get up, now I'm going through chemo again. Every morning I get up, I have kind of a new skin abrasion. So that's helpful. It's also helpful for hand and foot syndrome, which you can get from chemo, where your feet become red and cracked.
Like a neuropathy too?
Yes.
Calming Calendula Spray.
Yes, we love that, especially people who are on the job. They don't have time. They can't slather cream on. They just can spray that on and get some cooling relief.
Speaking of mastectomies and lumpectomies, you have skincare for scars.
Oh, yes. That's a new product. And I just love it. Because I have neuropathy, it's easier to wipe out from time to time. So I was recently going up this staircase and I couldn't feel my feet, and so I did fall. And I've been using that skincare for scars, and it really does that work.
And then we have this beautiful jar of My Girls skincare. This is the cream that we use when we get out of our radiation treatment. Yes. Would you say this is your number one product?
That's my number one product, and I actually have used it for 17 years on my face.
You look pretty good for somebody who's now currently going through chemotherapy. What is your prognosis now?
So I have metastatic cancer, which is very sad because I thought I did everything right. And they had given me actually probably in 2019, they had given me 5 years. But it's now going on 6 years. And what I do is I take Enhertu infusions every month. So it had gone to my spine, it had gone to my pituitary gland, but now with this drug, the lesions have disappeared, which they're amazed. And I feel great. I really do. The very first infusion, I did have nausea, but I said, I have so much to do.
And feels like you have a calling to do this work.
Yeah. I prayed to God. I said, I can't do any of this could you just please take away the nausea, and then I can keep going.
What do fans of your product say to you?
Well, that is what gives me reason to keep going. And when they call me up, a lot of times they start with questions about the product, but what they really want to do is talk about their fear.
Yeah.
And so we get into that. And a lot of times I hear, oh, thank God you're still doing this. I have a recurrence, or my girlfriend needs this. And a lot of times it's given out as a gift to a friend in need.
Many leading cancer centers are now recommending My Girls skincare. This must make you feel so good.
It really does. And what was funny, so I was, born and bred in Boston, and then we moved out to Oregon. And I had quite a few doctors from Mass General at Oregon Health and Sciences University. One of the radiation oncologists came into the room and he said, oh, you're My Girls? And I was like, oh, this is so great, because sometimes when you're in your own backyard.
You're too close to it.
Exactly.
In your opinion, Teresa, what does it take to be a successful entrepreneur?
I would say you need to be creative, you need to be self-driven, you need to have a good idea, and then you need to go vet it with your target audience and make sure it's something that's needed.
You've created an app. It's called Copeful, a play on the word hopeful. It's available for iPhone and Android users. Tell us all about that.
That was something that came about recently because so many people are calling us with a need to connect with the community and to talk and get their fears out. And they also ask how other people used our products. So I have lung cancer, I have breast cancer, I have even rectum cancer. Like, how do I use this? So we figured, all right, this app could be so uniting and comforting And when I started to do my research on other apps for just anxiety, let's say, they instilled fear in me because all I could hear about were these heart-wrenching stories and people going through certain things. And I didn't want to have an app like that. I wanted it to have hopeful strategies and tips for people going through a rough time.
They say that breast cancer changes you from the inside out. Has that been true for you, Teresa?
Absolutely.
How have you changed?
I try to keep my focus on work in check, and I try to focus more on my community, getting outside into that all those various communities that I have formed in my life. So like deep water running and all the ladies that go to the pool. And then there's the group from my town that get together regularly. Just, it's so nice to have a community of women that you can talk to. And then in Oregon, you have all the beautiful outdoor hikes. I get out every single day to do either like jazzercise or the deep water running or the hiking through the woods, forest bathing.
Oh, I've heard of this. Yes.
It's powerful. Real. Yes. I recommend it.
Does it have to do with grounding yourself somehow, your feet on the ground in the forest?
There's also that grounding. So I tried that as well. One of my jazzercise teachers said, just take your shoes off in the morning and go out on the wet grass. And you do feel differently. But through the woods, I keep my shoes on.
I think I would too. So often people don't know how to help a friend or a family member who's dealing with a cancer diagnosis. They don't know what to say. Can you offer some advice based on your experiences as a 2-time cancer survivor? What did you need from the people you love?
I needed laughter. That's my go-to. I needed positive people. A simple, I'm sorry, is fine. You don't have to get into the diagnosis or whatever. A warm blanket and fuzzy socks are good too.
Amen. How did becoming a mother change you?
I was always very career-driven, and I realized being a mother was the best thing that I could do.
Next 3 questions we ask everybody who is a guest on this show. And thank you for getting on an airplane and coming all the way from Oregon to be our guest today. When an obstacle is in your path, how do you get around it?
Unfortunately, sometimes an obstacle can't be avoided, but what I try to do is I look at it and I look at it from all different angles. What could I do with my skills and my people that are around me, people in the network that I might be able to have access to, and what can we do to keep moving forward? And sometimes it's not straight through beyond that obstacle. And if it changes, that's okay too, because that's part of your mission. And then, of course, I pray on it. I once heard Dolly Parton say she'd think about a decision she needed to make, and then she'd go to bed, she'd pray on it, and she'd make the decision in the morning. And she never made a bad decision.
What do you say to a woman who's just hearing for the first time, you have breast cancer?
I would say, don't despair and keep asking questions. Get a couple of second opinions from different institutions. I wouldn't go to Googling what you have. No. And I would say stay as positive as you can and do the things that make you happy. Make sure you find joy every single day. Look at my situation. It could be a death sentence, right? But I have so much to live for, and I have so much to be grateful for and happy about that I just keep moving forward every day. If there's a bad thought that comes in, I push it out.
Teresa, last question. I believe we live our lives in chapters. So right now, in this chapter of your life, what does success mean to you? How do you define it?
I would say success to me would be to launch this app for others and create a wonderfully positive community for them. We are still finishing out the functionality for Android and it's on the iPhone right now, but we need to add some things that we're working on. And then I would like to grow the business worldwide. So we're looking for investors and partners to work with to do that, because still breast cancer in Eastern Europe and other parts of the world is still considered a shameful thing. And some people go through it completely alone. And we want to be a source for those people and help them get through it with hope.
I want to say thank you so much for being our guest this week on the story behind her success.
Thank you, Candy.
And that's the story behind her success for this week. My thanks to Teresa Karastesh, 2-time breast cancer survivor and founder of My Girls Skincare. Find out more, mygirlscream.com. That's mygirlscream.com. I use her products religiously, including her aluminum-free deodorant, her soothing breast cream. That was a game changer during radiation. And when tamoxifen triggers severe muscle cramps, I slather on a product she calls Cool Comfort Gel. I'm smelling it right now. It's got a mint, gorgeous smell. Everything is organic. Fantastic. I slather it on. Just go to mygirlscream.com and enter promo code CandyO for your very special discount. This episode concludes our 5-part series on breast cancer survivors. Hey, don't forget to download your free load of Breast Cancer Wisdom on the homepage of my website. 10 quotes from 10 survivors. And thank you for listening. If you know someone I should feature on the show, nominate her today at CandyOterry.com. That's Candy with a Y, OTERRY.com. I'll have a new inspiring story for you next week. And remember, when we lift each other up, we all rise. What's your story? I can't wait to hear it.